on this lovely day. So I'll start today's media briefing with a look at our most recent data. Today we have 4 new cases. This brings our active confirmed positive cases to 73. We have 1 person in the hospital now due to COVID, and that person is in the intensive care unit. The good news is that none of our long-term care homes or retirement homes are in outbreak, and that's a first in quite a few months. However, cases are steadily rising again in our region. We are almost double the number of active cases we had a week ago. There are outbreaks in workplaces and in schools within the region. We are also seeing outbreaks associated with social gatherings. This is the hard part of operating within the province's safe and open framework. Just because we can't get together doesn't mean that we should get together. Our actions now determine whether we get moved into a more restrictive zone or get locked down again, as has happened in some regions. Despite how tired everyone, including me, is feeling, we still need your cooperation to keep cases down. So I also want to talk a little bit about the variants of concern. At the moment, approximately 40% of all the COVID-19 cases in the province of Ontario are screening positive as a variant of concern. This means that the viruses are changed or mutated from the original novel coronavirus identified more than a year ago. In our region, we've had at least 18 COVID-19 positive individuals screened positive for a variant of concern. And 2 of those have now come back from the lab as the B117 variant. Over the coming week, variants of concern will be identified on our dashboard for those who are interested in this information. A variant becomes a concern when it changes so that it has more significant effects. So the way it changes is in its transmissibility or spread, and these variants spread more easily. They can also sometimes make your disease more severe so that you may more readily need to go into the hospital. Some of the variants also affect how well the vaccine will work, and they also affect how we test and diagnose people. So all positive test results for COVID-19 in Ontario are now screened for a variant. When the sample or the test, the nasal swab, screens positive for a variant, we send it to the lab for confirmation of what variant it is. And that whole process to find out exactly which variant it is can often take about 2 weeks. So containing the spread of the variant is a very significant focus of the work of our case and contact management at the moment, because we all need to work harder to keep these more easily transmissible viruses from spreading. So now I'm going to talk a little bit about our vaccines. So this has been a very big week within our organization and within the region related to the COVID-19 vaccine. On Monday, we opened our first local mass immunization clinics. We have a fairly modest supply of the Pfizer vaccine this week. So Monday and Tuesday, we administered almost 600 doses. We'll do the same today. By next week, we will double those daily totals as we will be in receipt of a larger shipment of vaccine. One change you will notice in the guidance is that the interval between the first dose and the second dose of both the Pfizer and the Moderna vaccine has changed. Originally, when we spoke about this, we were using a 4-week interval between doses. Last week, however, the National Advisory Committee on Immunization, also called NACI, recommended extending the vaccination dose interval from 4 weeks up to 16 weeks for 3 of the 2-dose vaccines currently approved by Health Canada. That is the Pfizer, the Moderna, and the AstraZeneca. We here are following the NACI recommendation, and so we are changing the time between doses so that it's extended from 21 days to 112 days. This will allow more people to benefit from getting the first dose of the vaccine sooner. And it will also help to increase the level of protection from COVID-19 in our population generally. The first dose of the vaccine provides very good protection from COVID-19 all on its own. And then the second dose gives you a booster to make sure that your protection lasts for a good while. So current evidence from both the Pfizer and the Moderna vaccine indicate high effectiveness against symptomatic disease, hospitalization, and death from COVID-19 for 2 months after the first dose, including among older populations. So some people get quite worried when we talk about extending the interval between the first and the second doses, thinking that then it won't work as well. But vaccines are a little different from some of the other medication we take. So for example, if you make the interval longer between your pills when you're on things like your diabetes pills or your blood pressure pills, then the drug doesn't work as well. But for the vaccine, it's quite different. The vaccine stimulates your immune system. Your immune system remembers the vaccine and remembers that it needs to fight the COVID virus. Even though the interval is long, you still remember through your immune system. And then when you get the booster dose some months later, your immune system memory gets much stronger. So sometimes spacing out the interval is good for you because it makes your memory last longer in your immune system. So, Southwestern Public Health Region continues to manage an emergency response to the COVID-19 pandemic. Some restrictions have been lifted as we remain in the orange zone, but the risk is still here because the VOCs are circulating and our case numbers show this because they've doubled in the last week. So we ask everybody to continue on with their efforts to be compliant with all public health measures and to continue to be patient. This concludes my prepared remarks, and I'm going to hand the media conference back to Carla.
Thank you, Dr. Locke, for the update. So we'll now open it up for questions, and we have time for 2 questions each. I will start with Shane Ketnes.
Oh, hi, it's Shane Ketnes from Rogers TV. How are you, Dr. Locke?
I'm good, Shane. Good to hear you again.
I'm just wondering, how long did it take for this week's bookings to fill up?
So, interestingly enough, last week when we were booking for this week, it filled up really quickly in the first day or so. This week, we again opened up bookings at 8 a.m. last Monday, and we still have some spots for further bookings. So it hasn't even filled up completely yet for next week. So for anybody who's over 80, please note that there's still spots for you, and we're looking forward to seeing your bookings.
And how many vaccines are you giving this week?
So the exact number I'll have to get back to you about, Shane.
Okay, no problem. Thank you.
Thanks, Shane. And next we'll go to Rob Perry.
Hi, Dr. Locke. I just wanted to ask you first, how exactly do you screen for a variant as opposed to screening? Like, what's the additional screening that is done to determine if it might be a variant?
So the variants of concern that are out there right now, there's 3 of them. They share 2 common genes that show up. So what happens is the public health lab just tests for the presence or absence of those 2 particular genes. And if they find it, they know you have a variant, but they don't know exactly which variant it is until they do whole genome sequencing. That means they screen every little bit of RNA to figure out exactly the specifics of it. So when we get the screen, we know that you've got one of the 3 variants of concern, but we don't know exactly which one.
I understand now. It's different from the screening you do where you go, do you have one of the following symptoms? This is actual medical screening as opposed to that. Just going to the Ontario Police College for a moment, has there been any indication of how the COVID-19 might have spread so widely there before it was caught? And also, has there been any progress in making changes? I know the ministry has talked about working with public health in terms of getting students back in at the college. Has there been any progress on that you know?
So
from your end,
yeah.
end.
So good question. The college is an older building, and there are a lot of students there in a relatively small space. The nature of their training requires some form of physical interaction from time to time. And they also eat and sleep within the building during weekdays when they're on site for their education. So there are several factors there that make the spread of a virus like COVID easy. Lots of people in a smallish space, times when they eat together, times when they must interact physically. And so despite the fact that we, along with the college staff, have done our utmost to attempt to institute methods of teaching and, shifts in the cafeteria and cohorting in the sleeping areas, despite all of those efforts in that kind of facility, the virus spreads easily. And that's why we had so many of the recruits who became positive. We've done a very fine look at every last detail of the facility and how the training is provided. And so again, trying one more time to see if we can alter the way they do things to reduce the contact between individuals, while at the same time allowing them to achieve their educational objectives. So it's been a tough scenario within that facility to meet all those goals.
Thanks, Rob. We'll move on to Chris McMillan.
Hi, Dr. Locke. My question's regarding the city of Woodstock. We've noticed a big spike. It's gone from 9 to, I believe, 32 or 31. Maybe it's 33. It's been a big spike over the last 5 days. Is there anything that you can attribute to that? A lot of people in our area are wondering why our numbers have jumped up almost triple.
Yeah, so this has been clear to us that there are a lot of cases there, and we are concerned, which is why we're asking the public to double down on their efforts to include making sure they're adherent to all the public health measures. Some of the outbreaks have been in workplaces, some have been due to social gatherings, and some have been due to outbreaks related to the schools. We also, some of them involve the variant of concern, which spreads more easily. So between the different types of settings where people are close to each other, work and school, social activities where people were not abiding by the rules of keeping within your own small family bubble, along with the fact that we have a more easily transmissible variant now circulating in our community. All of those have added together to cause our case counts to go up.
Follow up, Chris?
Sorry, I was still muted. Thank you for that, Dr. Lockhart. No follow-up.
Thanks, Chris. Moving on, we'll go to phone number 319-2670, please.
Hi there, can you hear me? This is Kathleen.
Yep, hear you well, Kathleen.
Oh, okay, good, thank you. Thank you, Dr. Locke. Yeah, we've seen a lot of talk in the last day and a half or so about a third wave. Is it fair to say that we're in a third wave yet, or if not, is that coming?
That's always those crystal ball questions that it's hard to know what the answer is. We have definitely seen an increase in cases locally. The daily case count at the provincial level has gone up as well. There's been an increase in the percent positivity locally and at the province. So those do flag that cases appear to be rising. That said, we've got some mitigating factors coming our way. The warmer weather is coming and people will be spending more time outdoors and apart. Also, we've got the vaccine rollout starting to happen. So we're not sure whether the variants of concern will get ahead of us and we'll get into a third wave, or whether or not the mitigating factors may come along and modulate that third wave. So I don't think we're going to go down to no cases like we had for some weeks last summer, but we're hoping that we don't have that big wave that we had last winter. So it's a crystal ball issue right now, and we'll see where it goes.
Yeah, and just to follow up, if I may, one hallmark we've seen of the different waves is an increase in our institutional outbreaks. Now, knock on wood, there are none right now. But with the presence of the vaccine and so many residents being vaccinated, is it anticipated that those vaccines will now mitigate any rise in the institutional outbreaks that we could see?
So the variant that's most present in Ontario right now is the B117 variant, also called the UK variant. And the effectiveness of the vaccine, the Pfizer vaccine for that variant is quite good, meaning that the vaccine is able to decrease severity of illness, hospitalizations, and death for that particular variant. Other variants have been able to get around the vaccine. So we have to wait and see once again which variant becomes dominant over time. If it remains the B117, we're in good stead. If some of the other variants show up, the things might change for the worst.
Wonderful, thank you.
Thanks, Kathleen. And on to phone number 670-6004, please.
Hi, Dr. Locke. It's Ian at MyFM.
Hi, Ian.
Yes, hi, Dr. Locke. I missed the very beginning, so I'm not sure. Is there a breakout at this point on how many of the cases are the variant of concern, and will that be included in the daily dashboard?
Yeah, so starting shortly, we will publish the case numbers for our variants of concern by municipality, as we have already had the cases broken down on our dashboard. So you'll begin to see that. We plan to do that at least for a while. If the variant of concern becomes the only type of virus that we see, then we may change that again. But for now, we plan to publish the numbers.
Great. I've got a follow-up question, and it may be the same answer as the previous person asked for regarding Woodstock. We were seeing a quick rise in the numbers in Central Elgin, wondering if that's the same situation.
In Central Elgin, it's been more due to the just the workplaces and the social settings. There has, as far as I'm aware, there.
Okay, great. Thank you.
Thanks, Ian. And thanks again, Dr. Locke. That concludes our media brief today. If you do have additional questions, you can send them to communications@swpublichealth.ca. Thanks for joining us.
Okay.